What is functional medicine?
Functional medicine is not a specialty. That's what everybody wants to think. It's just a different approach to uncovering and treating chronic disease. You're looking for root causes and not just treating symptoms.
You said on your website, the root cause of my problems was a very unhappy microbiome.
Mm-hmm.
Major, I was going to look this word up.
Dysbiosis.
Thank you. And she wrote it. She should know. Major dysbiosis and leaky gut, which is a term you're hearing all the time these days. You said, I discovered that I had intolerances to wheat, whey, and eggs. And those Diet Cokes that you just described, you were telling people to go from a regular Coke to a Diet Coke, weren't helping either. That as a dietitian, you'd been told that was a solution. I made sure I got rid of toxic exposures. I discovered I had elevated mercury levels, and a regular sleep schedule helped too.
Yes, tremendously.
So what did your doctors think when you came in and told them that?
I didn't tell them anything. Are you kidding?
No. Well, okay, so something had to happen to make you a believer. Was there a turning point?
I treated myself. I started applying the functional medicine principles that I was learning to on myself, and it was working.
And what were those?
First of all, I did an elimination reintroduction diet and found out.
What does that mean?
It's something that we do on almost all of our patients if they've never done one, because it's first and foremost, you have to do that. You have to find out if you have any food intolerances.
So you get rid of all.
You remove a lot of the most common ones. And then
the ones I just listed: wheat, whey, eggs, dairy,
corn, soy.
Corn,
yes,
my favorite thing.
Oh, I have a lot of people who cannot tolerate corn.
And this gets real complicated.
But it does. It is sometimes. It's not just the corn. It's it's the GMO corn. There's all kinds of things to consider here.
Sweet filled corn is still good for you.
Yeah.
Sweet what?
Sweet corn. You're on the ear. You're eating. That's not the issue.
Oh, that's the same. That's okay because that's my favorite.
Yeah, I love it.
It's the corn. It's the GMO processed corn that's almost in everything. It's a thickener,
like the corn syrup.
Oh yeah, the high fructose corn syrup and things like that.
Yep.
That stuff. Oh yeah, everybody knows. Don't eat corn syrup. If it says corn syrup, please don't eat corn syrup.
Yeah. No.
Okay. So
I did that.
You did an elimination diet,
right?
And so I guess how long do you have to do that?
It's about a 60-day process. We do ours kind of differently because we rehab people's GI tracts at the same time while when we start the reintroduction phase to see if you react to certain foods, because it takes it can take up to 3 days to know whether or not you have a problem with a particular food.
It takes me 2 days to give a reaction to wheat.
Yeah.
It's always a 2-day. I've marked it a million times.
Mine immediately causes restless leg syndrome and some GI pain and headaches and joint pain.
So if I'm going to call you up and say, okay, help me, Dr. Beard, first thing you're going to do with that customer or patient is you're going to FaceTime with them and you're going to talk to them about an elimination diet.
Well, all of our patients. The process is quite intensive, and it's a good way to rule out or to weed out patients who are not going to be very good candidates for us, because
you got to be committed.
You have to be committed, and you have to be committed to making lifestyle changes, because those are going to come. So if you're not at that point, you're probably not a good fit for us.
And you've got to be miserable to be willing to do that.
Well,
hopefully not.
Hopefully not. I don't want people to come to us when after all the wheels have fallen off. Don't come to us before then, because it's much easier to help you.
Functional medicine helps you understand what is out of balance. If you use the metaphor of the stove, right? And you are a pot and you got a lot of stuff boiling, then what are your choices? You could put the lid on the pot, ratchet it down like a pressure cooker. And that's what we do when we put medicine on symptoms. We just try to cap it off, right?
Yeah.
But the fire's still burning. So the process that's driving that symptom is still going. You may have shut off one symptom, but it's going to pop up someplace else. So functional medicine works to understand what's in the pot and understand what's driving the fire and work to turn that fire off. When you
love
turn
that.
that fire off, those symptoms resolve largely on their own.
We don't just treat the symptoms. We go to the root of the cause.
The root of the root. And when you think you have the root of the root, then you ask the question why and see if there is an even deeper root.
Sounds like a lot of psychology goes into this.
Every chronic disease is a psychological challenge.
Really?
Really. Every chronic disease is something that has been created largely, something that's been created by a behavior somewhere along the way. And so any kind of behavior is a question of how does a person's mind work? What are they compelled by? What's been reinforced in their life? And those are psychological questions.
I remember when I was watching you speak, a girl said something about her eating habits and something, I don't remember exactly what she said, but she attributed her youth having sweets was a reward for her as a child and comfort for her, and that she was having a hard time breaking away from the comfort of eating chocolate and like you said, the root came from so far back as a reward from her parents.
That's exactly right. And that's why you need to understand the entire history of a person. So very often in conventional medicine, we do something called the history of the present illness. And if you let people talk about it without stopping them, they'll talk about 90 seconds at most. And do you think that that's the summation of everything you need to know? No, but with conventional medicine, we're often very happy with just a few pieces of information. When did this symptom start? When did it get worse? Does it get better? And then you work to treat the symptom. Here, it's like, so what contributed to the creation of that situation? And there you may have to go back way deep in life. You certainly have to know what the family history is. That gives you an idea about the genetics. You have to know what the intrauterine history is. When your mom was carrying you, when you were in utero, when you were a little baby in the womb.
It goes that far back.
What was going on with your mama that may have changed how your genes work through the course of your life? Did she get antibiotics? Was there a lot of stress? Did she smoke? Did she use any other kind of substances?
Oh, my poor daughter.
There you go. And so,
I smoked and was under a lot of stress.
it changes how genes get turned on. And in that critical time, that's a critical time. Of course, we all know that. In that critical time, some of those genes get turned on and they don't get turned off. If you were exposed to very low levels of toxins, sometimes when those genes get turned on early in life, it looks like you can't turn them off. And the best thing you can do is to learn how to cope with that. So to learn coping strategies that help you work around that. Now, if those genes are turned on, like when you're 5 or 6, it looks like those things can be turned off. But early in life, things sort of get hardwired at a point.
The 90% is what matters.
What do you mean?
Well, our bodies tolerate 10% of whatever we put in it pretty well, whether that's whiskey and Big Macs or Oreo cookies or whatever, right? If the other 90% of what we're consuming is coming from very health-promoting foods. And so I think that there's the diet that I follow as closely as I can is a whole food plant-based diet. So it is a diet where most all of my calories every day come from whole plant foods. So plant foods as grown, right? Not processed, not added oils and sugars and salts and chemicals and flavorings and all these things that come in our packaged foods. And so basically everything I eat every day does not have an ingredient list. I look at it and I know what it is. This is a banana. This is a sweet potato. This is a bean, right? I don't need to read the ingredient list to know what I'm putting in my body. And I think that's the key. And I think if people can aim for 100% on that, they'll probably hit the 90% mark, because our food environment in this country is so backwards, right? Where there is unhealthy food on every street corner and every convenience store and occupying most of our supermarkets, right? And the healthy food is hard to come by, right?
Isn't that just weird?
You can't go into a fast food restaurant and get healthy food for the most part, right? You have to really try to pick out, the right kind of salad with the right kind of dressing, or, get it and go to McDonald's and get a salad and an apple. But it's very outside of the norm. And so we live in this food environment where we're bombarded every day with advertising, for all these ultra processed foods and these things that we know do not promote health in our bodies, right? And so it makes it harder for us to eat a truly health promoting diet. And so I think when people can aim to do it nearly completely, they'll probably hit about the 90% mark. And if we can hit the 90% mark, I think most of us will be just fine long term. And so, people ask me, like, what do you do at Christmas? What do you do at Thanksgiving? I say, I eat whatever I want to eat on Christmas and Thanksgiving, right? It isn't what you do between Christmas and New Year's. It's what you do between New Year's and Christmas, right? And so, it's those choices every day. If you're making great choices 9 times out of 10, 99 times out of 100, you're going to do great. And, for people, I think most of them have this fear of not eating or fear of deficiency, right? This fear of protein deficiency. The supplement companies that didn't exist 70 years ago, right, have now suddenly convinced most Americans they need to take something to be healthy.
How do you feel about that?
I feel like it's one of the bigger farces propagated on the American public.
So I don't need vitamin D?
Vitamin D is made in your body by the sunshine.
So when someone says you have a vitamin D deficiency, you just go sit in the sun?
You go sit in the sun, yes.
How about B12?
B12.
Those are the 2 I take.
Yes. In our current environment where everything we buy at special basis, triple wash, sanitized, ready to eat, you do need to take a B12. If you were picking vegetables from your garden and brushing them on your leg and eating them, you would not need a B12.
If you liked this video, subscribe to our YouTube channel by clicking on the picture of Kerry's face in the center of the screen. For more of Kerry's interviews, click either video on the right of the screen. And as always, thank you for watching.